Good afternoon, students, to week 11. We are now in the practical stage. And as some students asked about the process, we look back at the welcome letter that told us exactly what we were going to be going into. And so we are going to be looking at the different points in the feet. So we're going to look at now where we're able to locate each point so that we can work it. And then we'll know exactly what method, whether we're going to use a walk, a hook, a pressure. We'll know exactly what to do in each point. So you will get a chart like this in the exam, and you will have to label the chart to tell the examiner exactly where you find each point. So you see number one, you look at number one and you recognize what number one is, and you will be able to say what to do. At that point on the chart where you have the number one, it's the pineal gland, and you see that it is on the inner part of the big toe, and that's where you do the pressure with the thumb. You pressure that area like 1, 2, 3 using your thumb. Then you look at point number 2, that represents the nose reflex, and it's on the outer part of the big toe. That also to get a pressure with the big finger. Then you have the mouth, same procedure. You do a pressure point there, 1, 2, 3, as hard as you can pressure along that line. Then we look at the pituitary gland. That is also labeled on the chart. And we know the pituitary gland, where it's located in the big toe, and you pressure that area 1, 2, 3. So you're trying to pressure, and you're also feeling if there's any lump, any hard area. And then based on your notes, you know that it's the pituitary gland is connected to the endocrine system, and you know that it's the system of the hormones. Then you have the hypothalamus gland, which helps to control fever, and that area you walk up and also you hook in. So you walk it up and then you hook halfway in with the big finger. Then, because we're looking at the chart in the order which is flowing in the middle of the feet, we see also the spine, the tonsils. And so right along here is a spine reflex, and you know you walk that area and you're feeling, you walk up that area with the big finger, small pressure moves. You don't bend the finger a lot, you push along the area of the feet to see if you're feeling any discomfort by the response of the patient, or if you're feeling any lumps, grains, hard area, right? Then you have the tonsils. This is right there at the point of the big toe, and you do a hook. So you'll have a chart, and you'll be able to look on the chart and realize that number 8 is connected to the tonsils. So we have number 7, number 8, all right? So we're going down the line. So we have 1, 2, 3, 4, 5, 6, 7, 8. And we see the tonsils there, and then we have the thyroid. So the tonsils are over here, and the thyroid are right here, okay? Then we go down to the parathyroid, pretty close to the thyroid area, and then you have the neck reflexes. Going down, you have the bronchi. When you reach the bronchi, you walk up the bronchi. You walk it up, and then across, like a hashtag. All right, then you have the bronchial reflexes on both sides. What we're looking at on this side first, the right foot. And then you have the esophagus right here. So you see the channel along here, in your imaginary line, your pressure point right along this point for the esophagus, all right? And so it's very good to keep reading and to listen to the anatomy of each system, the heart, the lung, the kidneys, so you're better able to remember what each term means. Then you have the thymus gland, right along here. You do a hook and a pressure in that area. Then you have the heart reflexes. You walk across the heart, same, and you do a hashtag sign. So horizontal and vertical. Then you have the lung reflexes, but we're going to look at those that are being highlighted in the middle area first. So we stop right at the solar plexus, then we move over to the left side. We see the brain up here. Then we see the sinus, the air, the upper teeth, the lower teeth, the inner ear. Along there, the pressure, you go and you use your thumb to pressure those areas. Pressure point, these areas are the hooking and big finger pressure. Then the neck, shoulder ridge, you walk across it and you apply pressure. Then you have the shoulder, then the lung, you do the same, walk up and across for the lung. Then you have the arm, you use a knuckle roll and you roll along the side of the feet. Then you have the diaphragm, you walk across the diaphragm, half point, and then walk another across half point 3 times either side. And then you can ask the client to inhale, exhale to the solar plexus point. Then you have the liver. So you're going to imagine the liver. It is taking up 1, 2, 3, almost 4 toes. So you walk across in this region and you walk up. And then right in the center, you'll find the gall bladder. All right. And then you have the stomach. You have the stomach. Larger area is the stomach. You walk across, you walk up, and you're also feeling in the center of that reflex point is the pancreas. And remember, it's on both sides. All right. Then the next point you do is the adrenal. You hook into that area with your big finger, 1, 2, 3 into the adrenal gland. And then you also walk the kidneys, or you hook into the kidneys with your big finger, pressure in that area where the green sign is saying that this is a kidney. And then you also position your hand so you're able to use your big finger and walk down this area, walking down imaginary all the way to the bladder. So you're walking down all the way to the bladder. So you angle your hand so you can use your left hand to do this while you use the other hand to support based on how the patient is sitting. All right. And that's for the kidneys. Then you go now to the intestine. You come a little way up, sciatic nerve point, major nerve in the feet. Then a little way up, the appendix, you press in that area. I have had cases where when I press here, it's the only pain the client had. And they later end up in ER, surgery, appendicitis. So I'm telling you, reflexology work. Then you have the ileocecal valve, ascending colon. These are all part of the colon, going up to the hepatic flexure, then across. People with constipation, you'll feel lumps and hardness in this reflex point, right? Remember that these points cross over into the other part of the feet. When you look at your chart, number 55 represents the hepatic flexure. So you have the, then you have, we have the transverse colon, and we can see the transverse colon is represented as point number 22. So you don't need to rehearse the points in your head for exams. The points are just there as a guide to show you the different parts of the feet and the different reflex points that you need to know. But you will never be tested by a code to say what number 1 is spinal. It is not set in stone. It's just to guide the student along in the practical, that the student will know exactly, you know, the sequence and how to get in to recognize and to locate each reflex of the body. So that's why the practical will take most of your time. The theory has now been completed, but you will now do 60 hours of practical and report it. You will now be given blank forms. You will now register each client to see their results and how you would report your findings on their foot chart. So you now need to do 5 persons 12 times or 12 persons 5 times to cover 60 hours. But you can't do 12, 60 different people. You must be able to treat at least one patient 3 to 4 times, okay? So that's for those who are asking. All right, so we go over to the prostate reflex point. So in the lower part of the feet, there's also a point to stimulate here, as well as when we go over onto this side of the chart. We have the sigmoid colon, and these are areas to stimulate because they connect and they help to ease different constipation and urinary issues. So we see the kidney reflex, the duodenum, transverse colon, small intestine. For the small intestine, you walk up and across. Ureters, you walk down the ureters. Fallopian tubes, you walk across. We pay more attention to it on the dorsal side. This is called the dorsal side. And then we have the bladder, the testes, and the pelvic on the left side and on the right. So similar points are on both parts of the feet, all right? So whatever is number 33 over here is also 33 over this side because it's the same point sinus. 34 is the air, upper teeth is 35. So the charts are matching in information, all right? It's just to help you, the student. So you will get a blank form in your email. Please practice the names of the different points, all right? And then we now go over to the next foot where we have the spleen. Remember, we don't have any spleen on the right, so we have to remember the spleen and the function, especially people with sickle cell issues. We put a hook and a pressure in this area, all right? Then we have the splenic flexure, or the ovary, which is on the other side, the descending colon, the sigmoid flexure, the leg, the sciatic nerve. So you notice that on the left and the right, the points are similar, apart from the area that we only have one organ or one gland. Then we go over to the medial side, which is the inner part. We are able to see the spine, and we know we walk the spine. We're able to walk the fallopian tubes, the groin lymph, help to drain the groin lymph, excess fluid. We also have the uterus, the uterus and the prostate, those reflex points. We stimulate that area with our fingers. We can walk it, we can do circular motion. And then we have the anus rectum reflex, where we use the thumb and the index finger, and we walk up, slide down, walk up, slide down, do that about 3 times. And we're able to get ease and to help with the hormone balancing of our clients. Then we go now to the dorsal, which is the reflex points that are directly on top of the feet. So we see a clearer view of the groin limb fallopian tube drainage point. We also see the hip knee reflex point, which is at the side and dorsal of the feet. We have the jaw reflex, which we basically, when we do the snow plow, we are going into that area because the snow plow, the alternate thumb crossed over the opening and closing of the chest area. Those techniques help to ease the pressure or discomfort in that area. So we see the lymphatic drainage point right there at the top of the toes. We see the lower and the upper teeth. And also for me, we squeeze between each toe to represent the lymph nodes reflexes. Then we see the side view, better view of the rectum, the sciatic, the hip, the lower hip, the hip, lower back, and sciatic. the ovaries, the testes. And so that is a great area to pay close attention to. All right. So we're going to look now at, we're going to look back at we don't want that one. We're going to look at the chart. Let me see if you can go ahead and if you are able to recognize the different points in the feet. We're going to go up from the top. So we see we have the stomach. Take a look at it by themselves. The pancreas, the colon. They're colored so you can see them by themselves. Okay, the adrenal gland, which is resting on top of the kidneys. The liver. The gallbladder, hook. The kidneys. You walk down the ureters. Lymphatic immune points. Spleen is a part of the lymphatic system. Yes, the spleen is. And you also see this area, they are part of the lymphatic immune, the drainage points. All right. We have the intestines. We have parts of the male reproductive system, testes, the prostate, on the inner side, and it is telling you they are related referral areas also in these points. You have the female ovaries. We also have the uterus ovary points on the outer sides. All right. We have, that's another, the ovaries. Okay. Then we have another part that helps in the reproductive area. Okay. Then we have the pelvic, especially with women who are in their final trimester, pelvic area. Then we have sciatic nerve, back pain, hip, knee joint. Okay. The neck, showing you the side view of the neck. All right, showing you the side view of the bladder. Showing you the side view of the rectum anus. So I try to code it for you since I'm not presently with you. So you're seeing it separately, right? So you, apart from the colored chart, you're able to identify it by itself. That's the fallopian tube, the bladder reflexes, all right? Then we have, okay, we have another point right there. And so that is also a very important area as we stimulate the body to, that's a pain relief point. We're able to relieve pain from that part of the foot. All right, it is called the hip lower back sciatic. And so you're able to stimulate right in that area of the feet. All right. Okay, let's go back to the, let me go here. All right. So that's a good point to learn. All right. Let me take it back from here. All right, so I hope that you are getting something from the charts as we want you to continue to practice. All right, let me see what else I have. We have the, okay, you said the chest lymphatic areas. We do the snowplow here to drain excess fluid from the body, right? The area of reproductive, the ovary, reflex points. Okay. We have the jaw area with toothache. Okay, we see that area help with the lymphatic flow. We see drainage points, and we see the upper and the lower jaw right there. It'd be amazing to know a person with aches and pains. And we would have seen this one already when we did a complete study on the areas in the toes, the pineal, the nose, the brain, hypothalamus, pituitary, the eye, the sinus, the teeth. So I want you to practice. I will take your hours by videos. So apart from your report, you would need every now and then to video a session that you're doing. Don't show the person's face. Show the reflexes, heart reflex, lung reflex. So solar plexus, remember always to close off with the solar plexus, breathe in, breathe out to make sure the person is relaxed, the bronchi. So we'd have gone over some of these already. All right, so those are key areas to pay close attention to. And now I'm going to look at a case study. So we're going to look at a case study to see how we can walk through the process. So I will guide the process as it is being done. All right, so the client is in the chair and we're now doing a warm up. We have already cleansed the feet. We have already assessed the patient. It's their second week. And so they are sharing their story as to their experience. So that's the lateral side of the feet. That's the medial side of the feet. And on top is the dorsal, really dorsal area, right? That help with chest issues. And we have already been able to pick up lumps that were currently in the body of one female. Yes. Okay, so we watch the process. And the plantar is directly under the foot bottom. Okay. Just form the hand and you do the snow plow, going down, up, down, with pressure. Then you do an open, you open the chest area. Take note, 4 fingers pressure, right? Videos are able to help you if you keep practicing. Play them and practice on a family member, all right? Millions of nerve endings are in that area of the body. Okay. We have the different tracks that represents lymphatic immune points. So we're clearing the tracks. Sometimes people with sinus issues, you will feel a lot of congestion in the area, grains and discomfort. All right, let's go. And remember to apply pressure. That's how you get it to the reflex point. It's called a pressure point therapy. Applying pressure to reflex points to get feedback. So we use that to stimulate the lymph nodes in the neck. There are patients when they're having a flu, like a terrible cold, when you do that index finger and the thumb, they feel a lot of pain. So it tells you that the lymphatic immune system is actually, there's actually a fight going on. The body is fighting. So it's giving a response that there is a foreign attack going on. They encourage the patient to drink a lot of water and to ensure they have the vitamin C and every type of immune food that they can get. Right? Remember, you can invest in your different oils, peppermint, eucalyptus oil, and you're able to, based on the client's issue, don't be afraid to research essential oils and their benefits. I will attach something in your email as well on the oils. Okay. You see, position to do the knuckle roll. Okay. All right. So the importance of doing the knuckle roll, we have had patients. The only problem they had was in the upper area right here. And when we checked it out, they had to do like a surgery on their upper arm because of a damage. So position, you, okay, here we go. 1, 2, 3. 1, 2, 3, 1, 2, 3. And it really is upper arm tensions. So remember now, even before you finish your exams, once you master the techniques of relaxation, you can actually start setting up your own relaxation foot treatment where you soak the feet, you have your Epsom salt, your warm water, your essential oils, get the patient in a very comfortable position, and you do the warm-up techniques, and you can start your little fee that will help you to cover your expenses, right? So after you've learned the techniques, you're able to start because here in Florida, you go to the malls and there are persons on the outside and they're charging you a good bit just for a 50-minute foot massage. So you would not be actually doing reflexology by doing the techniques only, but at least it's relaxation. It's the first stage to get to the reflex. And by you think you're comfortable enough, then you can go deeper. So get your hours in, then you get to sit your exams. You'll get exams to do just as testers, and then you're able to sit a final exam where you can get a completion certificate, so you're able to go out and be employed. So the next couple of weeks, you will be on your own doing clinical hours. We'll meet for the last official class next week. Then after that, you will be doing practical and reporting weekly until your 60 hours is complete. So, very important point, sciatic reflex point right there. Okay, we're looking at the lower leg. Okay, over uterus, prostate, those points right there. You can do circular and walk the area. Provide support to the feet. Providing support to the feet. We can use this area and pick up a lot of imbalances and send the patients on to see their gynecologist or their urologist for the men. Stimulate the area. All right. I want you to become comfortable, and you'll learn by continue to practice, practice, practice. All right, so just sit and watch the video and see if you're able to identify the different moves that the practitioner is making and which area in the feet is being stimulated. Okay, can you identify that point? Okay, identify the points. Remember, we have the pituitary gland, the hypothalamus gland, the sinus, the thyroid, the parathyroid. All those are in the big toe. Based on where we're at now, we are stimulating those points. So remember to ask the client, are you having any discomfort? Between 0 to 5 or 0 to 10, tell me the pressure at which you're feeling the pain, or would say how hot the pain is, the intensity of the pain. All right? Remember, the small toes have the inner ear, the sinuses, the second and the last toe. Remember, we are able to walk up each toe and zone each toe. So you do the zoning of the toes, and you're feeling while you're zoning. So remember to zone the feet and take your time and go through the session. So zoning of the feet is very, very important. So as you zone the feet, you are able to feel while you're preparing yourself for the session, right? You're preparing yourself for the session. So each point have a sequence, the toes, then the chest area, where you find the lung, the heart, the shoulder, then you have the stomach area, then you have the large intestine, then you have the pelvic, then you have on the medial side the spine, then the outer side the upper and lower leg, hip, knee. So just flow with the sequence and keep looking at your chart. All right? Remember, it's always about practice, practice, practice. So I'm going to take a look back at the large chart. Let me take a look back at the chart. All right. So look at the chart. Keep this chart in mind, get a copy, put it beside you, so that you can, flow, keep flowing, keep a chart in mind so you do not miss the points. And then you can study each point and the different health conditions that can happen to people when any one of these areas are not functioning at its best. So I hope that this practical session helped you some more to open your eyes to the different stages and the different ways that you will do reflexology. Continue to practice, practice, practice.